AVM, or an arterial venous malformation, is essentially an abnormal connection between an artery and a vein. In normal circulation, blood goes from the artery to capillaries to a vein. In this sort of malformation, there's that missing connection of the capillaries where the arteries directly connect to the vein. There's no transfer of the oxygen and nutrients that happens at the level of the capillaries. And also at the level of the capillaries, it serves sort of as a pressure release. So when arteries are coming up, it's very high pressure to a very low pressure venous system. What that can do is cause the venous system to dilate, sometimes on the arterial, sometimes on even the venous side. You can develop aneurysms. Patients are generally born with it. Unfortunately, they are not diagnosed until they develop symptoms, either being headaches, seizures, and unfortunately hemorrhages. The approach to arterial venous malformations generally are multifaceted. A lot of it depends on the size of the arterial venous malformation and whether or not it affects important parts of the brain, such as speech, motor, vision. The traditional approach is surgical resection, where we perform a craniotomy, where we temporarily remove the skull, open up the covering of the brain, find the vessels feeding the AVM, clip them, coagulate them, and physically remove the abnormality. Sometimes we're able to use coils and glue to completely take care of a vascular malformation without further surgery. We reserve, lastly, options such as stereotactic radiosurgery like Gamma Knife, particularly in areas of the brain, such as the brainstem or close to the brainstem, or areas close to the speech area or to motor area that could potentially cause significant loss of function. One technique that we are able to offer is something called 4D digital subtraction angiography, a technique to help understand the architecture of vascular malformation. Through one of the vessels that supplies the vascular malformation, we're able to obtain a three-dimensional structure through our software. The software also allows the ability to watch blood flow from the arterial to the capillary to the venous side. So again, we are able to understand the arterial feeders, the draining veins. We'll have a better idea on how to approach the vascular malformation either endovascularly or surgically.